Have you been feeling low lately? Perhaps you're not just sad, it might be more than that. It could be depression. In our fast-paced world where life often seems like a constant whirlwind of tasks and responsibilities, it's all too common to brush off feelings of persistent sadness as just a part of life. However, it could be indicative of something more serious: depression. Depression is a prevalent mental health condition that affects millions worldwide, and it's more than just feeling blue. It's a complex disorder characterized by a range of symptoms, both emotional and physical. It's important to understand that depression is not a sign of weakness or a character flaw. It's a real, legitimate health condition that requires understanding, compassion, and appropriate treatment. It's time we shed light on this often misunderstood condition. So, what exactly are the symptoms of depression? Stay tuned as we delve deeper into this topic. Depression is not just about having a bad day or feeling blue. It's a serious mental health condition that affects a person's thoughts, feelings, and actions. Depression is a complex and multifaceted condition. It's not just a fleeting feeling of sadness or despair. It's a persistent state that can last for weeks, months, or even years. It's like a heavy, dark cloud that hangs over your life, draining your energy, your motivation, and your joy. It's a constant struggle with an invisible adversary that never seems to let up. Depression doesn't discriminate. It can affect anyone, regardless of age, gender, or socioeconomic status. It's a global issue, affecting millions of people around the world. And yet, despite its prevalence, it's often misunderstood. Many people confuse depression with sadness, but it's important to understand that they are not the same. Sadness is a normal human emotion. We all experience it at times, and it's usually tied to a specific event or situation. When the situation changes or we've had time to process our feelings, the sadness typically fades. Depression, on the other hand, isn't tied to any specific event. It can strike out of the blue and persist even when things in your life are going well. It's an ongoing, relentless feeling of despair that interferes with your ability to function and enjoy life. Moreover, depression is not a sign of weakness or a character flaw. It's a real, medical condition just like diabetes or heart disease. It's caused by a combination of genetic, biological, environmental, and psychological factors, and just like other medical conditions, it's treatable. Depression can be a difficult and lonely journey. But it's important to remember that you're not alone. There are people who can help, and treatments that can make a difference. So if you or someone you know is struggling with depression, reach out, seek help. With the right treatment, you can regain control over your life and start feeling better. Now that we understand what depression is, let's explore the common symptoms. Depression manifests itself in various ways, and the symptoms can be both physical and emotional. One of the most common symptoms of depression is persistent sadness or a low mood. This isn't just a case of feeling a bit down or upset for a day or two, which we all experience from time to time. No, this is a constant feeling of sadness that lingers for weeks or even months on end. It's like a dark cloud that hangs over your life, dampening your spirits and making it hard to feel joy or happiness. You might find yourself crying more often or feeling empty and numb inside, as if you're just going through the motions of life without really living. Then there's the loss of interest or pleasure in activities you once enjoyed. This is known as anhedonia. Perhaps you used to love painting or playing guitar or going for long walks in the park. But with depression, these activities lose their appeal. They no longer bring you joy or satisfaction. Instead, they may feel like a chore or a burden. You may even start to avoid them altogether, preferring to stay at home or in bed. Lastly, feeling tired or lacking energy is another common symptom of depression. You might feel physically drained even if you haven't done anything particularly strenuous. Simple tasks such as getting out of bed in the morning or doing the dishes can seem overwhelmingly difficult. You might also experience a lack of motivation or focus, making it hard to complete tasks or make decisions. Even if you get a full night's sleep, you may still wake up feeling exhausted and unmotivated. It's important to remember that these symptoms can vary from person to person, and they can be influenced by a range of factors, including your physical health, your environment, and your personal circumstances. They are not a sign of weakness, nor are they something to be ashamed of. They are simply signs that you may be dealing with depression. These are just the tip of the iceberg. There are more symptoms that could indicate depression. Continuing from where we left off, let's look at some more symptoms of depression. The first one we'll discuss in this segment is changes in appetite or weight. Now, depression doesn't play by the rules. For some people, it might mean a loss of appetite, leading to significant weight loss without even trying. But for others, it may result in an increase in cravings, particularly for foods high in carbs and sugar, causing unexplained weight gain. This symptom isn't about a few pounds here or there. It's about noticeable changes that don't align with your diet or exercise habits. The next symptom is difficulty in concentrating. Depression can make it hard to focus and make decisions. It's like trying to see through a foggy window. Tasks that once seemed simple become complex puzzles. You may find it hard to pay attention during conversations or while reading and watching TV. Even making small decisions like what to have for dinner can feel overwhelming. Lastly, we'll talk about feelings of worthlessness or excessive guilt. This is a tough one. Depression often includes persistently feeling bad about yourself and ruminating over what you perceive as past failures. You may feel a disproportionate sense of guilt for things that are not your fault or are beyond your control. It's like carrying a heavy backpack filled with self-doubt, regret, and self-blame, and it can be incredibly draining. Now, it's essential to understand that these symptoms can occur in varying degrees and combinations. You might experience some of them without others. You might have good days and bad days, and that's okay. It's all part of the complex puzzle that is depression. Remember, these symptoms are not exhaustive. There are other signs that you might be dealing with depression. Depression is a complex condition, and its symptoms can vary from person to person. As we've explored throughout this video, the manifestations of depression are as diverse as those who experience it. Yet there are certain common symptoms that often come to the fore. We started by discussing the emotional symptoms of depression. The persistent feelings of sadness, emptiness, or hopelessness that weigh down on the individual. Like an invisible burden they can't shrug off. The loss of interest or pleasure in activities that were once enjoyed, a telltale sign of this condition, and the pervasive sense of worthlessness, guilt, or self-blame that can make every day a struggle. Next, we delved into the physical symptoms that can accompany depression. The changes in appetite and weight, whether it be eating too much or too little, losing weight without trying, or gaining weight unexpectedly. The sleep disturbances, where some individuals may sleep too much, while others struggle with insomnia. The constant fatigue or lack of energy that can make even the simplest tasks seem insurmountable. And let's not forget the unexplained physical problems, such as back pain or headaches that seem to have no other cause. We also touched on the cognitive symptoms of depression, the difficulty thinking, concentrating, or making decisions that can affect performance at work or school. The frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide. Remember, these symptoms are not just a phase or a sign of weakness. They are indicators of a serious health condition that requires attention and treatment. If you or someone you know is experiencing these symptoms, it's crucial to seek professional help. Reach out to a healthcare provider, a mental health professional, or a trusted person in your life. There are numerous resources available to help navigate the journey towards mental health. Hotlines such as the National Suicide Prevention Lifeline offer immediate assistance and are staffed by trained professionals who can provide support and guide you to local resources. Websites such as the American Psychological Association or the National Institute of Mental Health provide a wealth of information on depression, including how to recognize the symptoms and where to find help. Depression is a serious but treatable condition. Treatment often involves a combination of medication, psychotherapy, and lifestyle changes. There's no one-size-fits-all solution, and what works best will depend on the individual. Depression is a battle, but you don't have to fight it alone. Reach out, speak up, and get the help you need. Remember, it's okay not to be okay. You're not alone in this fight, and there are many people and resources ready to lend a hand. Never hesitate to reach out because there is always help available.